possible to have this kind of a wonderful conference. I really thank to Thai government, Dr. Odomsil, and Thai friends. I would like to introduce the speaker, David Jonigan, at this moment. Dr. David Jonigan is a director of a Center on Alcohol Marketing and Youth, funded by Center for Disease Control and Prevention, as well as associate professor in Department of Health, Behavior and Society at the Johns Hopkins Bloomberg School of Public Health. Also, he has served as an advisor to World Bank and World Health Organizations. Please welcome Dr. David Jonigan.
Thank you very much. I'd also like to invite my other rapporteurs to this, particularly Surasat from Thailand. Would you come up? So it is our job to tell you what happened, and it's a big job.
Thank you, David. First of all, I would like to thank all of you, the participants, for your coming, that some of you travel long distance to serve, to remind us how important this conference is. The conference had 3 plenaries and 29 concurrent sessions. We have 850 participants from 55 countries, including parliamentarians, government officials, academics, and civil society. We gratefully acknowledge the contribution of all 33 session rapporteurs. They come from 11 countries to support us, the 3 lead rapporteurs. For our rapporteuring process, each session had 2 or 3 rapporteurs. They receive template for 3 PowerPoint slides and 500-word summary for summarizing the conference sessions. Both PowerPoint slides and summaries will be compiled in the conference proceedings. Here is the list of our rapporteur team and 2 coordinators. Thanks to all of them for their hard work. Thanks also to the whole organizing team in Korea and for Abapa Gapa for this success in organizing the GAPC 2013. Then I will give the floor to Dr. David Jonigan for providing summary of the conference session to all of us. And let's have a weekend for him.
Thank you. Would you join me in giving a big hand for the team that has done so much to organize this conference? Okay, I promise I'm not going to read you all of those summaries of everything that happened, but this is going to go quickly. At the opening plenary, we heard that knowing is not enough, but we must apply, and willing is not enough, we must do. We heard we must not treat alcohol as an individual problem any longer, but rather as a threat to the foundations of our society, and that there is a list of effective prevention measures, so there are no longer any excuses not to do anything. The problem, you've heard, 3rd leading cause of death and disability, one of the main risk factors for non-communicable diseases, a large problem still undercounted, with things like alcohol-related crime and injuries to public servants like police, emergency services workers, medical personnel, security staff, and so on, uncounted. One speaker referred to the destruction behind quenching the thirst, the devastating effects on families, including interpersonal violence, child abuse and neglect, poverty, stigma, and broken homes. The economic aspects of the problem, drinking the family budget that can lead to debt, hospitalization, absenteeism, and unemployment. In some countries, the poor consume more. In others, the wealthy consume more. But in all cases, the poor suffer more. Drinking patterns affect work performance among industrial workers in low and middle income countries. And the alcohol costs to society exceed the revenues that come from alcohol to society. Harms to others are often neglected and ignored. They are everywhere and affect everyone. They are complex. They are unjust. They are about ordinary people and a story too often told, but too seldom counted. They affect our children through fetal alcohol spectrum disorder, from family violence, and so on. As one speaker said, it's a clear market failure, so every state has the right to intervene. And we learned from MEC the power both of data and the power of the human stories we have to tell. The problem, it is a corporate-induced set of diseases, driven by an alcohol industry interested in increasing consumption through designing, marketing, distributing, and pricing alcohol products and politically protecting them from restrictions, with its stated aim to increase consumption, for instance, in South Africa by 30% in the next 20 years, and advocating for ineffective and obstructing effective policies, using self-regulation to block effective policies, with marketing exploding in social media, which promotes high user engagement, and also with sponsorships and alcohol-branded merchandise abounding, especially among youth. The problem also, women, an emerging market for this industry. Women are now bearing the burden of their own as well as men's drinking. Young people, also a growing market for the industry, particularly in low and middle income countries. And alcohol advertising at relatively low levels has great influence on them, creating the meaning of alcohol, literally constructing it for them. But we have successes. We have successes like Seoul, where they recently banned alcohol advertising on public transit and on large rooftop panels. We have Korea's new proposed national alcohol policy, which you've just heard about. In South Africa, the cabinet approving a comprehensive alcohol advertising ban. The ban in Bhutan, the movement that Sally talked about on marketing restrictions in countries all over the world. We have the creation of national alcohol policies and plans in high and low income countries. We have minimum pricing moving forward as a concept and a reality in Scotland and elsewhere. And we have the Director General of the World Health Organization speaking out more forcefully and fully on this issue than ever before in history. We have effective community mobilization occurring, and when governments are not responsive, we have civil society taking over the process of developing national alcohol plans, as has happened in the UK with Health First, in Malawi, and elsewhere. We have creative use of social media, such as AdShame in Australia and campaigns in Estonia and the north of England. But we also face many challenges. The international trade agreements prioritize economic objectives over public health goals. Our ability to strengthen restrictions at the local level is often limited by preemption at national and subnational levels. The resources available to deal with alcohol problems do not come anywhere close to matching the magnitude of the problems. And we frequently face the failure of people who should be our friends in public health to understand or want to touch alcohol policy. We face lack of support from policymakers at the national level to address alcohol problems. Mobile and social media are the new frontiers, and the industry is far ahead of regulators, public health, and civil society. We face the issue of social supply of alcohol, particularly to minors. We face the need to reduce the harm, but also to reduce the likelihood that non-drinkers will start drinking in a harmful way. And we often face that public opinion is most supportive of the least effective strategies and least supportive of some of the most effective. On taxation, we face the issue that taxation may not affect youth drinking as much as we'd like if the primary source for youth of alcohol is social and not commercial. We have inflation making alcohol more affordable if taxes are not indexed to inflation. We have individual income growth making alcohol more affordable. And we face challenges in controlling unrecorded alcohol, as well as the impact of free trade agreements on taxation policies. In physical availability, where there are laws, we are challenged by poor enforcement of them, by the lack of support from government to address the retail sector, and lack of resources for enforcement. We face the challenge of the size and popularity of informal retail sectors in some regions of the world, and the fact that buying places may be different from drinking places, especially when lower prices drive people to buy from off-premise outlets. There is still a great distance between what the research shows is effective and what policies are in place and are enforced, and there are still, as you've also just heard, major portions of the world with few and ineffective alcohol policies. And the relationship between alcohol and sports, so carefully forged by this industry over the last 40 years, is too often unchallenged. But we have solutions. We have social movements. The concept of the triangle that moves the mountain, where we join knowledge creation with social mobilization and political involvement to make the research deeply meaningful, to make it have legs and impact in policy circles. We're building our ability to build capacity with multiple packages of materials now available to help us improve our ability to build broader coalitions and to advocate in communities with policymakers and with the news media. As you heard this morning, in tax, we know we need alcohol-specific taxes that reflect the potency of alcohol, adjust for inflation, and control affordability. On physical availability, we need to protect and safeguard government monopolies and move towards more licensing schemes with proportionate fees that control density, clustering, location, and type of present premise. We need stronger restrictions on trading hours and minimum age laws and control of social supply. On marketing, it's always best to start with a ban and work backwards from there. There's a push, we need to push for stronger and clearer regulation of online marketing, but it's clear that the alcohol industry is not to be part of the solution here. They are much of the problem. And there needs to be an independent monitor of adherence to the law. We need to involve and engage civil society in enforcement of restrictions on marketing and provide incentives for them to do so, as they do in France. And we need to educate the public about the industry's marketing strategies. We are using community voices at the local level and on national platforms. We're learning to advocate at multiple levels. Local change is sometimes easier to achieve than national change, and we can build from local and national to global. We're learning that scarce enforcement resources are often better used for the larger sellers than the smaller ones, and that community action should be integrated into law enforcement, especially in low and middle income countries. And one solution is also to devolve authority for policy and enforcement to the local level, where there's greater potential for community voices to outweigh industry pressure. The statement of concern itself is one of our solutions, calling out and documenting the industry's conflict of interest and mobilizing large numbers of people to expose this. The global alcohol strategy and the best buys that focus on the effective and cost-effective interventions, the moves to get rid of cheap alcohol, and of course, perseverance, knowing that, as all of you know, from all the effort that you've taken to get into this room, to make things happen where you are, that with perseverance, change can happen. We are building and expanding our coalitions. We had a stream through the conference that focused on advocacy. And some of the lessons of advocacy that we're sharing with each other include using research to counter the industry's arguments about the economic burden caused by alcohol control policies, using media and media advocacy to promote our messages, organizing at the local level, especially when policy change may not happen at the national level, and creating new networks in different regions throughout the world. We know the importance of identifying, engaging, and mobilizing key stakeholders, building powerful coalitions, and reaching out to other non-governmental organizations and movements. And we know that we need to advocate not only for new policies, but also for maintenance and enforcement of existing policies, and that we can learn from what the industry does to inform our own advocacy. Resources for advocacy can come, as they are in some countries now, from national health promotion funds created from alcohol taxes. As one speaker put it so well, we can translate the disappointments of past experiences into usable knowledge for future initiatives. But not all of our past experiences are disappointments. There are models of successful mobilization occurring around the world from which we all can learn and be inspired. And now I'd like to invite my other lead rapporteurs up with me to share with you our brief overall conclusions from the conference. And I will begin by saying that from the opening day, it was clear we are getting better at measuring and quantifying alcohol's impact, including the harms to others.
The alcohol industry continues to oppose effective policies and actively work to increase the consumption.
There have been many successes recently as countries develop national alcohol plans and start implementing the best buys.
Our advocacy skills are growing, and the sharing of advocacy experiences inspires and teaches us all.
The triangle of knowledge creation, social mobilization, and political involvement can indeed move the mountains.
Alcohol policy is everyone's business, and we need to involve everyone in it.
All three of us.
Local and national action will lead
to global change. Thank you.
Now we have prepared a meaningful moment in time to end the GAPSI 2013 Seoul Conference. For this moment, 13 representatives of the 55 attending countries will come forward to help us make a declaration for modern alcohol policy. They will read each one section. We will all read section 14 together. Soon after the end of section 13, let's give them a big hand.
It is my job to introduce the declaration. The declaration begins with a preamble that reaffirms the global strategy, WHO's global strategy to reduce alcohol-related harm, reaffirms the overarching principles of the Global Action Plan for the prevention and control of non-communicable diseases, and expresses the need for a target of achieving at least a 10% decline in total per capita consumption within a calendar year in liters of pure alcohol. It recalls and reaffirms the statement of concern, calling on national governments and international and intergovernmental agencies to resist alcohol industry lobbying efforts actively. It expresses goodwill and strong commitment to support the implementation of WHO's global strategy and notes that this conference has mobilized representatives of governmental sectors, non-governmental organizations, researchers, and community leaders from all over the world to promote and support action to reduce alcohol-related harm. It then has a section on the rationale for action, where it reminds us that alcohol is among the 5 leading risk factors to global death and disability, that more than half of alcohol-attributable deaths are from non-communicable diseases, and that alcohol-related injuries, alcohol's role in infectious disease such as TB and HIV, fetal alcohol spectrum disorder, and cultures of drinking and heavy episodic drinking among young people and women of childbearing age are growing and significant global concerns. Alcohol's potential for harm is comparable to that of other dependence-producing substances under international control and is increasingly recognized as a commodity that requires accounting for public health concerns in bilateral and multilateral trade negotiations. And alcohol use contributes to poverty and hunger and affects the achievement of international development goals, including the Millennium Development Goals. Evidence-based and cost-effective interventions exist to reduce alcohol-related harm, and examples include what you've heard for the last 3 days. Raising prices on alcohol, restricting access to retailed alcohol, reducing drink driving, and enforcing bans and restrictions on alcohol advertising and marketing. And pricing policies particularly can reduce alcohol consumption, prevent ill health, and increase the resources for health prevention and treatment. With that as the preamble, we then have the following call to action. We therefore call on intergovernmental agencies, NGO networks, national and local governments, academia, civil society, professional organizations, communities, and individuals at all levels to take action by, at the national and local levels, supporting, strengthening, and integrating into national development agendas the evidence-based interventions outlined in the global strategy, and especially the 3 best buys: reducing physical availability, restricting or banning alcohol advertising and promotion, and raising the price of alcohol, in order to make our communities safer and individuals healthier and protect those at risk from harms caused by the drinking of others.
Number 2, increasing, prioritizing, and supporting budgetary allocations for reducing alcohol-related harm at the local and national levels, and exploring the provision of adequate, predictable, and sustained financial resources through domestic innovative financing mechanisms, including raising alcohol taxes or establishing an additional surcharge on alcohol beverage to fund a health promotion agency free from commercial interest and mandated to carry out research and public health advocacy in support of cost-effective interventions to reduce alcohol-related harms and to assist those affected by it.
Article 3. Establishing the strongest possible statutory restrictions on alcohol marketing of all kinds, in recognition of the growing body of literature linking youth exposure to alcohol marketing with increased likelihood of early initiation of alcohol use and greater likelihood of adverse consequences of alcohol use, including injury and dependence, and the right of young people to grow without pressure to drink.
4. Strengthening efforts of civil society groups and organizations to reduce alcohol-related harm, implement the global strategy, and promote other evidence-based policies at the local and national level. Civil society organisations that are independent from the alcoholic beverage industry and free from conflict of interest have an important role to play in engaging with governments and advocating for effective alcohol control policies.
Number 5, establishing and strengthening country-level surveillance and monitoring systems using indicators, definitions and data collection procedures compatible with WHO information systems on alcohol and health, including periodic national surveys integrated into existing national health information systems, and include measures of alcohol consumption and alcohol-related harm, such as adult per capita alcohol consumption, recognising that such systems and measures are critical for advocacy, policy development and evaluation purposes. Governments should make provision for the independent evaluation of policies, protect the independence of science from commercial and other vested interests, and make results of monitoring and evaluation available to the general public in order to sustain and advance public health agendas on reducing alcohol-related harm at local and national levels.
Number 6, at the international level, exploring the provision of adequate, predictable and sustained resources for implementation of the WHO global strategy to reduce the harmful use of alcohol at the global level through bilateral and multilateral channels, including traditional and voluntary innovative financing mechanisms.
Number 7, ensuring appropriate resourcing of World Health Organization as the lead United Nations specialized agency for health to enable collaboration with WHO member states and non-governmental organizations in scaling up implementation of the global strategy at all levels and strengthening national efforts to reduce alcohol-related harm, as well as in assessing and monitoring progress made.
Number 8, developing effective global governance for reducing alcohol-related harm at all levels, taking into consideration current experience in addressing other risk factors for non-communicable diseases, including tobacco use, unhealthy diet, and physical inactivity, and taking action to protect effective policies from commercial and other vested interests of alcohol and related industries.
Article number 9, ensuring through the actions of national signatories as well as international governmental and non-governmental organizations that bilateral and multilateral trade and investment agreements do not undercut, invalidate, or in other ways limit national and subnational efforts to establish and enforce evidence-based policies to reduce alcohol-related harm, including government monopolies on alcohol distribution, minimum pricing and health-oriented taxation, and restrictions on physical availability and marketing.
Article 10, supporting development of a platform science-based discussion about how at global, national, and subnational levels to create and implement policy that support the rights of children to grow up around the world free from commercial pressures to drink alcohol.
Article number 11, mobilizing global social movements and support of civil society groups and organizations bringing together alcohol policy activists, youth and youth-related agencies, professionals, scientists, consumers, persons with communities, personal experience of alcohol-related harm, faith, communities, gender-based organizations, and others for joint advocacy activities in support of effective alcohol control policies and implementation of global strategies to reduce harmful use of alcohol.
Article 12, calling upon the Global Alcohol Policy Alliance, GAPA, and its regional affiliates, as well as other relevant international associations and organizations, to strengthen the networking, information sharing, or collaboration among civil society and professional organizations for reducing alcohol-related harm in line with the aims, objectives, and the guiding principles of the global strategy.
Article 13, acknowledging the contribution of international cooperation and assistance in reducing alcohol-related harm, and, in this regard, encouraging the inclusion of the goal of reducing alcohol harm in development cooperation agendas and initiatives, including initiatives to fight poverty, build democratic societies, halt and reverse the spread of HIV and TB, empower women, reduce crime and violence, grow national capacities, address non-communicable diseases, and improve road safety.
Please lead Section 14 together, including
prevention and control of non-communicable diseases and their risk factors,
including alcohol-related harm,
in discussions of the substantive process that will lead to the definition of a United Nations Development Agenda post-2015 and revision of the Millennium Development Goals.
Thank you. Representatives, please return to your seats now. And for award ceremony, Dr. Moon, please stay on the platform. This is the time for our award ceremony. The chairman of GAPSI 2013, Ong Nyun Moon, will present the award. This is the Best Poster Award. The winner is John Vianney Armania. Congratulations. Please come up to the platform.
Mr. John Viana Yamana from Uganda.
Congratulations again. This is the Best Opinion Award. The winner is Donald Ziegler. Congratulations.
Mr. Donald Ziegler from USA.
He wrote the best opinion about the Seoul Declaration on the website of GAPSI 2013. Thank you, Dr. Moon. At this time, our beloved president of GAPA will make a closing remarks. Let's show him our appreciation.
Friends, on behalf of the Global Alcohol Policy Board, it gives me great pleasure to thank, first of all, Professor Sung-Soo Chun for all his work in making such a wonderful conference. I don't think he could have done this without the support of Miriam Welsh and all her helpers, and the smiling faces of the young people greeting us as we traverse the corridors trying to find our assembly rooms. And we do have regional cooperation. We work at regional level. And already Thai Health has been thanked by Professor, and I think we should also continue to thank the work that Thai Health Foundation does, not only in their own country, and not only in the region, but internationally. And I especially would like to thank Sally Caswell because she put the program together. And I think it's been one of our best programs. So thank you very much, Sally. And I've also got to thank, and I want to thank David Jernigan, because together with Sally and ourselves prior to the Syracuse conference in 2000, we worked together in forming this, and I have been my main strengths during that period. And so thank you again very much, because this is your result as well. And I'd like to thank the National Assembly for sending Mr. Choon Jim Kim here. It's very good that we end with the presentation of the strategy for Korea, and delighted that a parliamentarian has found the time to come along and receive that and work for it in his assembly. Thank you so much. This conference is witness to an enormous boost to raising awareness of the alcohol problem and the scientific evidence needed to determine effective policies to reduce alcohol-related harm independent of commercial interest. I hope when the WHO representative, Mr. Dag Rekva, returns back to WHO Geneva, that he will report that this conference is witness to the fact that the WHO global strategy has created a climate of concern for effective action based on the 10 actions outlined in the strategy. That there is a growing international movement of public health advocates, research scientists, and civil society groups determined to meet the challenge to create a movement, an international social movement, at both national, regional, and international level to foster the political will to meet the challenge of the counterforces that are obstacles to effective policies. Victor Hugo, I quoted a German poet, I'll quote a French poet now, encouraged us by his remarks that all the forces in the world are not so powerful as an idea whose time has come. And as we leave and continue our journey till we meet in Edinburgh in 2 years' time, may we also, as David has reminded us, of the words spoken by myself at the beginning of our conference, the words of the German poet Goethe. And may those words be our guide and our strength for persevering in our actions. Knowing is not enough. We must apply. Willing is not enough. We must do.
Thank you, Mr. Rutherford. As our next speaker, let's invite a member of the National Assembly, Chun Jin Kim, from the Democratic Party. He will make some closing remarks. Let's welcome him up.
Dear and respected GAPC presenters and attendees, I would like to take this opportunity to thank you all for coming so far to help Korea and the global community of health workers. I hope that this excellent conference will have provided some of the necessary tools for you to take home to continue to advance the level of health in your own countries. I really believe that this is worthy expenditure of your time, fund, and energy. It was not for nothing that you came to Korea. Something of great value has been accomplished during your stay in the land of the morning comes. Upon the necessary groundwork for the advancement of modern, progressive, and effective alcohol policy has been laid here. You all have been a part of the historical moment for Korea, and our desire is that this moment will extend it into your own countries and have a positive effect on the lives and health of the population of those nations. I personally am proud to have had a small part in this effort. Now, there is serious work ahead of each of us, and especially in countries like Korea, who feel substantial burden from the rates of alcohol harms. Let us take courage from the presence of such professional, knowledgeable, and competent family of researchers, writers, and teachers. I had not expected such a truly rich offering of the information to verify the need for better, more modern, and competent alcohol policy. I can now see more clearly what has to be done in Korea, and the possibility of the solid progress is laid out with the convicting rates of the evidence. I am greatly encouraged about the near further advancements in health alcohol policy for the protection of the Korean people. I believe that what we now do here in Korea may have a positive effect on the similar need of other nations. In this way, this is truly a global effort, a lead of other nations. In this way, this is truly a global effort when the modern nations of the world set an example in progressive alcohol policy. Formulation and establishment, we can be certain that this example will prove to be of use to other nations in the development of their own policies to protect and elevate the health of their home populations. Again, I thank you all for making the effort for global health advancement. Welcome once more to Korea, and I have high hopes that we will see you again in the near future. Have a safe return to your homes and great success in further research, teaching, and administration. Thank you.
Thank you, Dr. Kim. We will now have the National Assembly member from the Democratic Party, Yong-E Kim, bring us closing remarks. Let's give him a warm welcome.
I'm very pleased to see the closing ceremonies. It was very impressive, the most impressive that I have ever seen. And I'm quite sure that you will move the mountains, because I tell you this because you are more political than any politicians. I'm very happy, and I can tell you how happy I am to see you all in Korea for this GAPC 2013 Seoul Conference. This is a landmark gathering of alcohol policy and alcohol harms experts from so many countries around the world. You have taken the time and expenses of coming to help Korea and global community with huge handicap and problems. So many of us here in Seoul have fighting this battle, and we felt almost alone sometimes. When I see all of you here, I gain great encouragement. And I know that I'm in the presence of true professionals. I'm sure that in the years to come, there will be a population of Koreans and others in many countries who owe their continuing life and health and prosperity to this very Seoul conference. As I know that I'll look back on this occasion and be able to see the turning point in the alcohol harms conflicts in Korea. In the future, there will also be those in the countries represented in this room today who also have benefited from their example of taking time, making an effort and sacrifice for the health and prosperity of the global community. They will be encouraged and inspired by what you have done and what you are doing, as I have seen. When you are tired and maybe a little disencouraged, just remember that you are not forgotten and your effort is not in vain. Korea thanks you again and add my personal vote of gratitude from what you have done for us. Please have a safe trip home and enjoy the rest of your stay in our grateful country. Just outside of the door, we have a splendidly beautiful day among the beautiful days of Korean autumn. Just don't miss it. Thank you very much.
Thank you, Dr. Kim. Now we will have the Global Alcohol Policy Conference flag delivery ceremony. I respectfully ask Chairman Moon and Evelyn Gillan to come up to the platform. GAPSI 2013 Seoul Conference Chairman Moon, please hand over the flag for GAPSI 2015 Scotland to Conference Chairman Evelyn Gillan. Ladies and gentlemen, now that the flag is delivered to Scotland, please extend congratulations and wishes for the success of the Scotland Conference. Thank you, everyone. Thanks, Chairman Moon. Now, GAPSI 2015 Scotland Chairman Evelyn Gillan will make a speech. Let's welcome her.
I thought I was getting away there. I had forgotten I wasn't quite. We are so delighted to be invited to be the hosts and to have that in our request to be the hosts accepted by GAPA. We've had a wonderful conference here with our most gracious Korean hosts, and we have a hard act to follow. We can't promise you that the weather will be as pleasant in Edinburgh, but we can promise you a very, very warm welcome, and we will all keep the flag flying in our own countries until we all come back together again in Scotland. Thank you.
This brings us to the end of this conference. I hope all our invited guests will have a meaningful time during the remainder of your stay in Korea. Thank all of you for your participation in these many productive hours. Thank you all and health blessings for the coming years.